Hi, I'm Dr. Erin Rushing with Comprehensive Hearing Solutions, and I want to talk to you today about what is hearing loss. So, hearing loss is a diagnosable condition that someone has when their peripheral auditory system is not functioning normally. We actually have another video on the peripheral and central auditory systems and how they work together to comprise the totality of the auditory system. But the peripheral system is responsible for converting sound energy into electrical impulses that go into the central auditory system up to the brain. If there is an issue or a breakdown in any of the parts of the peripheral auditory system, the person has a hearing loss, a diagnosable hearing loss. So, how do we know that? Their auditory thresholds fall outside of the normal range. So, an auditory threshold is the softest sound that someone can hear, and we actually ask you to respond to that as part of our testing procedure. And so, the person on the left here has thresholds that are 20 decibels and softer, and so the person on the left has normal hearing. If we look at the audiogram on the right, this person's thresholds are 25 decibels or poorer, which means that we had to turn the sound louder in order for them to hear, upwards of 70 decibels in some of these higher frequencies. And so they have a measurable hearing loss. This means that they have a problem somewhere in that peripheral part of their hearing system. And through a variety of tests, we can figure out what part we think might be causing the problem. So, do you have a hearing loss? We need to perform diagnostic tests to find out if you do have a hearing loss or not. And once we do that, we could actually provide a diagnosis. So, do you have a hearing loss? What part of the ear it may be in, and why do we want to know about it? We want to know about it to know how to proceed with treatment going forward. What are going to be your treatment options? So I hope that this gives you a good overview of what hearing loss is and why you need to know.